Action.
Alrighty, my name is Corbin Hyland. As many of you know, I'm an EMT instructor, and tonight we're going to talk about mental health in EMS and why it's important to us. There's several reasons why this is kind of near and dear to my heart. A paramedic that I worked with earlier this year shot himself in the head and actually lived to tell about it. So this is just something that we want to kind of go through with y'all, because y'all are about to hit the street, you're about to be in these stressful situations, seeing these traumatic events, and we want y'all to kind of understand, how to cope with it, and if you're having troubles coping with it, who to come to and kind of who to talk to about it. So this is an illustration I like to use kind of when we talk about this stuff, because it's very true. There's a stigma around mental health in pretty much everywhere. No one likes to talk about mental health. And it's got the fireman who's like, man, I can do this, my pride's got me, I'm gonna be fine. And the sharks of depression, suicide, marital status, PTSD are kind of surrounding them. And it's a battle that you'd be surprised that more people than you think actually fight. So there's common mental health disorders we're going to talk about that kind of affect our professions: law enforcement, EMTs, paramedics, firefighters, soldiers, post-traumatic stress disorder, depression, anxiety, and then suicide isn't really a mental health disorder, but they all accumulate ultimately to that if you don't do something about it. And the substance abuse is important as well. Some statistics you probably didn't know: 1 in 5 Americans in a year they'll basically have some type of mental illness or mental problem that'll affect them in their everyday life. 1 in 25 will have a significant problem that will affect them throughout the rest of their life. And this is kind of another reason why it's near and dear to my heart. When I was in 6th grade, I was diagnosed with generalized anxiety disorder. I've battled that since I was like 10 or 11 years old, and I'm 23 now. It's not something, maybe 10 people in the entire world know I have it, because I hide it very well and no one really knows. If you'll notice, like when I talk like this, I'm okay, but I have some tics that I do with my hands and my eyes. I take a medication on a daily basis. It's like one of the lowest doses they make for it. And I see a psychiatrist once every 6 months. But initially I was in an inpatient program, and for a week I was in an inpatient program, then I was in an outpatient program, then I saw a therapist twice a week for about a year, year and a half, 2 years. And basically here I am today. I'm actually one of the few people that have it that are successful in life. I've got an associate's degree, I'm a master paramedic at the job I do, I teach here, and I don't have an issue. But some of the things that bother me the most are large groups of people. I don't like people yelling in my face. That kind of bothers me. I wouldn't be able to go to the mall, concerts, but kind of now I've gotten to the point where I can do all that and not have any issues. And you're going to learn some more about generalized anxiety disorder kind of later on. So we're going to talk about post-traumatic stress disorder first. The definition of post-traumatic stress disorder is a disorder that develops in some people who have experienced a shocking, scary, or dangerous event. It can be different for anybody. It could be a soldier that went to war. It could be me seeing a dead body on a call. It could be you seeing a traumatic event, a crime, a robbery, a murder take place. And children especially can be affected in different ways by different things. Even seeing something scary on TV, they can acquire post-traumatic stress disorder from it. It's natural to feel fear after a traumatic event. Fear triggers many split-second changes in the body. It's kind of your fight or flight. It helps you stay safe during that moment. The people that develop post-traumatic stress are the people that still feel that fear up to a month afterwards. And the true definition is basically people that are diagnosed with PTSD, they must have all the following for at least 1 month: at least 1 re-experiencing symptom, at least 1 avoidance symptom, at least 2 arousal and reactivity symptoms, and at least 2 cognition and mood disorder symptoms. Some of the re-experiencing symptoms are bad dreams, flashbacks. You get in it and people have actually killed their families because they thought they were in a war zone. Frightening thoughts. Avoidance symptoms: staying away from places, events, or objects that trigger the emotions. Arousal and reactivity symptoms include being easily startled. If you're scared by just kind of walking in a room, you don't expect a lot of people to get kind of nervous like me. Being easily startled, feeling tense or on edge, having difficulty sleeping, having angry outbursts. Cognition and mood symptoms include trouble remembering key features of a traumatic event, and you'll see if you'll kind of focus on that, it actually goes throughout depression and anxiety as well, and that's kind of some of the reasons I have trouble remembering some things. Negative thoughts about oneself and the world, distorted feelings like guilt or blame, loss of interest in enjoyable activities. So if they love to go hunting, fishing, and now they're just like, I think I'm good, I really don't want to do it. So some of the risk factors, anyone can develop PTSD at any time. Obviously the people that are in high stress environments, soldiers, firefighters, paramedics, police officers, we're all kind of at risk because we willingly put ourselves in traumatic and stressful situations because we don't have a 911 to call, we are it. Not everyone that obviously goes through a traumatic event develops PTSD. There are a few risk factors, like obviously being in the service and doing different things like that. There are also resilience factors of like people, the reason like why I would say I probably don't have PTSD, even though I've seen some pretty horrific things in my career. Seeking support from other people. I mean, I don't really like go out and say, hey, I really need to talk to you about this call, but we might BS on the way back to the fire station or something like, hey man, this was, it was a real bad call, this is kind of what we saw, and it helps us decompress. Finding a support group, obviously if it bothers you a lot. Having a positive coping strategy, being able to basically get out and talk to some people. So there's treatment for PTSD, obviously people with severe PTSD, medication, this is kind of something they don't want to go with, but it's there. Psychotherapy is talk therapy, is going and meeting with somebody and talking about the events, and they'll have different coping mechanisms you can use and kind of ways to decompress the anger and everything. And a lot of people, this is an ongoing battle. I mean, I picked up a guy that was huffing cans of air freshener outside of Walmart because he was a soldier, he was a Marine in Iraq for 2 tours, and that's how he's coping with it. And his family's basically gone, he has a daughter, and his family's destroyed because of his substance abuse that's kind of led into that. So now we're going to talk about depression. Depression is a common but serious mood disorder. Everyone gets depressed sometimes. We all go through a stressful event in life, or we all go through something that we're just like, kind of get down about. But, this is, people to be diagnosed with depression have to have that symptom for at least 2 weeks on end. So persistent sad, anxious, or empty mood, feeling hopeless, irritability, feelings of guilt, worthlessness, helplessness, a decrease in energy, an increase in fatigue, and just kind of not wanting to eat. There are some risk factors for depression. They include personal or family history of depression, major life changes, trauma, stress, being in school, trust me, I know. Certain physical illnesses and medications also have some side effects of depression. The treatment, 2 people are affected by depression in the same way. So me and you could be affected 2 completely different ways. Some of the treatments obviously are medications and the psychotherapy, the talking to people and kind of figuring out what's the best course of action. So anxiety, this is the one I know the best. Occasional anxiety is normal. Before a test, before a big day, it's normal. A person with anxiety disorder, basically it's not going to get any better and it's not ever going to go away. It's going to constantly be there. So generalized anxiety disorder includes restlessness, feeling on edge, being easily fatigued, irritable, difficulty concentrating, your mind going blank. Panic disorder, your symptoms kind of include repeated attacks or repeated fears, an increase, worry when the next attack will happen, a fear or avoidance of places where panic attacks have occurred and do occur. And then social anxiety disorder, which is what I had, feeling highly anxious about being with other people, feeling very self-conscious, being very afraid others will judge you, staying away from places where you basically like to be, and having a hard time making and keeping friends. So there are some risk factors that going into that, like basically any stressful times in life, anytime, anything that's going to be stressful, then there is a way that they can test for it. There's an elevated cortisol level. So some of the treatments include the talk therapy, the psychotherapy, medication, obviously. There's self-help and support groups for everybody. And kind of one of the last things we'll talk about is suicide and substance abuse go hand in hand. Our paramedic was high and on, he had drank a lot of alcohol before he shot himself. He actually lived, but it's actually the 10th leading cause of death in the United States. Between the ages of 15 and 34, it's the 2nd leading cause of death in the United States. So the signs and symptoms, obviously, of suicide, they're talking about suicide, they want to kill themselves, they might want to kill other people. Talking about great guilt, feeling uncontrollable pain, withdrawing from family and friends, saying goodbye and kind of giving away their stuff, like, hey, I'm not going to need this anymore. So suicide doesn't discriminate. There's no age, race, sex that says, like, hey, you're going to die of suicide or anything. But depression, mental health disorders are a big thing that kind of lead to suicide. Prior suicide attempt, a family history of suicide, and family violence. And there's 5 kind of action steps we can take: is ask, keep them safe, be there for them, help them connect to a support group, and stay connected. So one of the important things is dissolving stigma, and we can do that through education and talking about it, and not letting them be in the closet. So there's a couple of just pictures of, there's a guy named Daniel Sundahl that takes these kind of photographs and does this, and he's a big advocate for depression, PTSD, and mental health. And then my conclusion is my favorite quote from Patch Adams, which is, you treat a disease, you win or you lose. You treat a person, and I guarantee you'll win every time, no matter what the outcome is. So thanks for listening to me.